So, I don't know about you, but being a teenager in the 90s, I always wanted to have the perfect golden tan. I laid out with my friends during the summer and used tanning beds during the dark Midwestern winters. Maybe you also remember the coconut smell of Hawaiian Tropics SPF 4, or maybe you remember the Playboy bunny stickers they gave you at the tanning salon so you could see just how tan you were getting. I think back and wonder, what the hell was I thinking? Now, as I approach 50, I have sunspots, age spots, wrinkles, rosacea, melasma, breakouts, and the list goes on and on and on. And this isn't even addressing the skin cancer concerns from years of trying to get the perfect tan. Today, we're going to talk about all things skin, what you want to know, and what you need to know, especially during the summer months. I'm Betty Wang, the host of Betty's Smart Friends. I'm a certified financial planner who helps women be more empowered and feel less alone when it comes to their money. I'm so excited to welcome board certified dermatologist Dr. Sam Stoler. Dr. Sam has been with About Skin Dermatology and Derm Surgery since 2011. She is known not only for her medical expertise, but also for her warm and personal approach with her patients. I should know. I'm one of them. I'm one of the lucky ones. Also, when you see her in person, you can't help but notice and be a little jealous of her beautiful and unblemished skin. We're so lucky to have Dr. Sam here with us today. Please welcome her to our podcast. Thank you, Sam. Yay, I
Hi,
appreciate you.
Betty. I'm
So
so
glad
happy
you're
to
here.
be here. Oh, thank you for inviting me. This is wonderful.
I have so many questions, I don't even know where to start.
Please, I hopefully have so many answers.
Okay, so for people like me, I'm sure I'm not alone. Growing up in the 90s, we wanted the tan. We thought we were being healthy by using SPF 4 so we wouldn't burn. Um, I myself also used Crisco and baby oil. Not on my face, I was very careful. Face, I used SPF 4.
Okay, good.
Okay, yeah. What can we do now that the damage is done?
Yes. Okay. First of all, I don't know anything about those Playboy bunny stickers. So
Well, did you go tanning?
I did not. And I didn't know I was going to be a dermatologist, but I did not ever do that. My college friends did lie out on like a black tar roof, of which they tried to pressure me to do that. And for some reason, I was too bored, too antsy, too hot. I never did. So
Wow.
my sun exposure, which I had some, was just from sports and living, but not purposely tanning. So interesting. I got to look into those Playboy bunny situations. So,
Well, they also had hearts. So it just kind of
oh,
depended how
depends
sassy.
on which
Yeah, how
which
sassy
place
you
you
were
went to. Yeah,
feeling, and then you
got it.
just like you put it on
Okay.
the same place so you
Yeah.
could just see how much damage you
Yeah.
were
Well,
doing
when
to
we
your
do
body.
procedures in the office, we give people these blinder goggles, and so many people are like, "Oh, these are like the tanning bed goggles," and I'm like, "See, that's why you're here, you know."
Yeah, that's true too. I actually, yeah,
um,
my poor parents were like, I don't understand.
yeah. So the question of what we can do now. So for everyone, and this is sort of a podcast directed, I guess, mostly at middle-aged women, but anybody, first and foremost, starting to wear sunscreen every single day is number one. Because no matter what damage you got, whether it was on purpose or not, we can't turn back time. We can only sort of help our skin moving forward. And the less damage that we incur now, the better. So first and foremost, it is sunscreen every day. And we can talk more about types of sunscreens and which ones are better later. But for any age, doesn't matter who you are, every day. And Colorado is beyond, like, we get so much UV daily. So that's number one. Now, I'm a dermatologist, and so if there's any skin concerns, we want you to come see us. And what we do if you make a visit with us is either a medical visit or a cosmetic visit. And from a medical standpoint, which is really the most important, if you come in for a skin check, we are looking for early signs or any signs, of course, of skin cancer or precancers. Now, there are three main kinds of skin cancers. The one that is the scariest is called melanoma. And we do a screening for that. Now we ask people to also look at themselves, and melanoma looks dark or black. It would be a mole potentially changing. But way more commonly, we see basal cell and squamous cell carcinomas, and they're often pink or scaly or scar-like or pimply, and may not be obvious. And overall, we assess for just sun damage, and there are things called actinic keratoses, which are precancers, and they're pink scaly lesions. And if anyone has any one of these things, that's our primary concern in the office, is to address these and take care of them as needed. And this is something that we do all the time. And we can pivot into cosmetic things. Now, if people have skin cancer, they often have a lot of cosmetic damage and needs as well. So
Where do you see that most often? I think I've been really surprised with friends that it's in their hairline. Like a lot of times it's in their hairline.
yeah.
Or like
It's interesting.
yeah.
Yeah, I have a couple of women that I can think of in particular that are our age that have multiple basal cell carcinomas in their hairline. And I don't know if that's just a susceptible area, or you put sunscreen and don't really get it
Yeah.
really close to your scalp. I don't know, but truthfully, you actually can get it anywhere. Now, sun exposed areas are the most common places. So, face, the chest, really anywhere. But the more sun exposure you're getting on an area, the higher risk that area is going to have sun damage and then potentially skin cancer.
When should anybody, I guess, start getting regular checks? I know in Colorado, it's recommended to start earlier just because people have been in the sun.
Yeah, that's a good question. So melanoma is a real skin cancer, and there is a familial genetic predisposition for melanoma. So if there's a family member, a parent who has it, and especially if they got melanoma at a young age, then really the answer is any age. But kids start developing moles, and some of that is a genetic thing unrelated to sun. And some people have really atypical moles, and that can also start coming pre-puberty and then really accelerate in puberty. So if someone has a family history of melanoma, or there is a preteen teenager who's developing moles, and if they're a little bit atypical, then they should come in childhood. If there's not really that history, and especially if someone has a little bit darker skin and they don't have a ton of moles, probably in Colorado, I would say probably in their 20s. Now, it does depend on how much sun damage they've had. And if there really isn't a lot of damage and not a lot of risky things, you don't necessarily need to come every year. Once you start seeing, the signs of sun damage, and or you've had atypical moles, or there's anything precancerous, then at least once a year and sometimes twice a year. And in Colorado, I mean, the youngest person I've seen with a basal cell is 18 years old. So there's not a exact answer. It depends on who you are, your skin type, family history, your sun exposure, and then anything that you've ever had personally. So it's never a bad idea to come in. We have kids that come in because their parents have had something. And sometimes then we just do skin cancer and sunscreen awareness and just educate them on taking care of their skin in general. So, and then we see kids in general for acne and eczema and warts and stuff too. So I have a lot of relationships with kids. But from a skin cancer perspective, it's very dependent on their family risk factors and their exposure. Yeah.
What? So, I mean, I don't want to go down too much of the cancer discussion, but like, what's the difference between the basal and the squamish?
Okay. Yep. Squamous.
So
they come from different cell types.
Okay.
So in my office, I draw this really horrible diagram that I probably should just get one that actually looks legit, but my art skills are kind of lacking. But I kind of like to talk as I draw. So in the skin, there's multiple kinds of cells. So the cell origin for melanoma and basal cell and squamous cell are all different. So melanoma comes from a cell that's called a melanocyte. which is the pigment cell. So if you have darker skin, you have, more melanocytes, more melanin in your melanocytes. Your normal skin cells. So if you like rub your skin and you get some dead skin, those are called keratinocytes. Those cells, if they become atypical, it is either what's called an actinokeratosis or a squamous cell, and it depends how deep that goes in the skin. And then we all have what are called basal cells. And so between the top layer of the skin, which is the epidermis, and the second layer, it's called the dermis, there's a basal layer, and there's cells there. Those are natural and okay, and they're called basal cells. But if they become cancerous, that's called a basal cell carcinoma. So the cell type is different. So if you have a basal cell, it can't mutate into a squamous cell and into a melanoma. It's a basal cell. Basal cell and squamous cell can kind of look similar. They can be pink and scaly. We can sort of tell the difference, but sometimes a person cannot. And then melanoma is often dark or black, can be pink. It's called an amelanotic, but essentially the cell type is different.
So if you have something that's like red on your face or wherever on your body, I mean, I'm sure I'm not the only one who'd be like, oh, it's fine. We'll see how, like, it'll go away.
Correct.
How long till you decide, like, should it go away within 2 weeks? And if it's not, then come in?
Yeah, so the most common times we see that is with a basal cell because they can look like a pimple. So you can get a little shiny bump that's like, oh, it looks like a pimple, but ultimately it never goes away. And so, it's always hard if this is someone's first time, because they're not expecting it, and you may not have a dermatologist and you think something will go away. If someone has had a history of a skin cancer, they know better and will come in. But usually I say give it a few weeks, and if it's a pimple, it should evolve or go away. And if it doesn't, now thankfully basal cell carcinoma is actually really slow growing. So if you waited months even, and some people even wait years, it doesn't usually metastasize. So it's not life and death. It just would get bigger. And at some point you would know. It would either bleed or it would just look really weird, or you would have some sign that you need to get it checked out. And squamous cell can be a little more aggressive and they grow a little more quickly, still not very quickly, but it becomes more like a bump. So you kind of know that you have like a wound or a bump or something that's not healing. So if you've had it, you're kind of more in tune to your own skin and but often, thankfully, it's not a rush. Now, if you ever see a changing mole or something that triggers your body to think, oh, this looks really different and it's dark, you do want to try to come in as soon as possible, because for melanoma, time is really of the essence, because the deeper it gets in the skin, the more risk it could actually spread through your body. Yeah. Yeah.
So if preventative care is the SPF, I've been reading about SPF layering, and does that work? Do you recommend that?
You mean putting multiple things that have SPS on your skin? Yeah, I mean, so SPF, just so people know, means sun protection factor. So really it means how many times more are you protected at the moment that you put it on versus not wearing it, okay? And actually it's done really specifically for the chemical sunscreens, really less for the zinc and titanium. They just extrapolate that. But so if you do SPF, 30, and you actually put it on, which most people do not, based on the recommendations, which is really kind of heavy and thick. At the moment that you put it on, you're 30 times more likely or less likely to get sunburn than if you didn't have it. Okay. So the answer is really the more SPF you put on, the higher your protection is. It's not a matter of time though. So if you wear SPF 100, it doesn't necessarily give you more time. If you sweat, that's going to come off the same as 30 or 50. And so layering is great so you don't get a lot of incidental sun at the time that you're exposed. And then in theory, one of the most important things is if you are out and you're sweating or not, it does naturally wear off. So you should reapply, especially here in Colorado. So layering is good.
So layering is good. Does
Yeah.
it matter like between mineral and chemical or?
Yes. So, well, yes. Okay. So we haven't even talked about cosmetics, which is
Oh,
probably
wait. Yeah,
really
because once we get
what
there, you're not going to be able to turn me.
that's fine. And we'll pivot into cosmetics, which would be treating wrinkles, brown spots, redness, anti-aging, which we
Yeah,
can't
right.
anti-age. We can just slow aging.
I'll
But when
take
we
it.
get into, yeah, when we get into that, um, mineral sunscreen is actually way more important. So in terms
Hmm.
of skin cancer, okay,
Yeah.
um, it doesn't really matter. Like, first of all, we say that whatever sunscreen you're willing to wear is the best sunscreen. Okay. And so the difference is, right, is chemical sunscreens are, as they say, often in America, about 5 chemicals made up to give you a broad spectrum protection against both UVA and UVB. Okay. Individually, some do UVB, some do UVA, some need to stabilize them. And so it's a concoction to give you a broad spectrum of protection against the whole UV spectrum that causes DNA mutations, sunburns, skin cancer down the road. Okay. So chemical sunscreens, they do actually do a really good job of protecting you against the DNA damage. And what happens is the UV comes in and those chemicals kind of break it down before you get mutations. Okay. What it does not do, and the reason that people like the chemical sunscreens, is give you a protective barrier over your skin. And so it still triggers the melanocytes to make pigmentation. You still can damage a little bit of the dermis, which down the road will lead to less collagen and wrinkles. So, from a cosmetic standpoint, we recommend the physical blockers, which are called zinc oxide or titanium dioxide, at least again here in America. In Europe, they have way more chemicals and other blockers, but we're a little bit limited. So we recommend a daily zinc or titanium base, especially for your face, sunscreen or moisturizer, because you're going to get a benefit in protecting against browns, and we can talk about melasma and pigment. If you're out and you don't want that paste and you're playing a sport and you want it to rub in easier, then go for the chemical sunscreen. Again, whatever you're willing to wear. But cosmetically, you're going to have a lot more benefit downstream by using the mineral sunscreens. And then we can talk about, people worry about, do the chemicals accelerate any hormonal issues, cause cancer? None of the data is really that strong for any of that. But people do worry. So the question is like, can we limit the chemicals that we put on our body? And by using the physical blockers that don't absorb, they just reflect the UV, you're not technically exposing yourself to as many chemicals. And globally, if we're all using chemicals and then it gets washed off into the water, like, yes, we're putting it all back into the environment. So we like physical, but they tend to be pastier, whiter, rub on all your clothing and your cars. And so it's a balance.
Interesting.
Yeah.
So if you wanted to be super, super careful, would you do a chemical and then a mineral, or is that just
I mean,
overkill?
I mean, if you do a mineral, you don't technically need the chemical and it stays on a little bit better. Some people do both at different times for different areas. Sometimes, I mean, I wear a mineral on my face every day. My neck actually is a little sensitive. So sometimes I'll wear a chemical one on my neck and then physical on my body. So people will mix and match. Um, but it depends on what your skin can tolerate, what you prefer. Again, anything is better, especially if we're talking about skin cancer prevention.
Can you just give an example of like what's a mineral,
Yeah.
SPF, what's a physical, and what's a chemical? I mean, I know
Yeah.
that.
No, so actually for the mineral sunscreens that you could wear every day, like you really need SPF 30 to 50 as your daily. And there's some great moisturizers that have that. And we can talk about brands, and my office sells a lot of stuff. We like this brand Elta MD, which is sold through dermatologists. Color Science makes an awesome tinted one called Color Science Flex. And actually tinted, we should talk about.
Yeah.
Yeah, again, as we're going to talk about cosmetics, there is benefit with tint actually in protecting against pigmentation with fluorescent lights and visible light. And there's something in tints called iron oxide. And for people that have melasma or pigment disorders, having a tinted daily sunscreen actually gives them an extra layer of a protection that is kind of in that visible spectrum, which is great. So
I just started. I just started with the tinted.
And then you don't have to wear as much makeup. It kind of gives you that base. Sometimes it can work as your foundation. And so it's a nice way to have SPF on every day and not have to think about it.
Yeah, I'm still kind of getting used to it. It feels like I don't usually wear makeup, so it's just, I'm always afraid it's going to rub on something, or when I see it on people's shirts, I'm like, oh.
I know. So it's like tinted for your face, and then maybe like white or clear for your neck, and hands too, that rubs off. But face, neck, and hands are super important, like every day, especially driving. If you're in a job where you have a job where you're in the car, like you get so much on your left side, your hands get a lot, and then you just get a lot of exposure. So every day, face, neck, and hands.
Oh, I've never thought about my hands.
Yeah.
That could explain the age thought on my hands. What about the chemical? So like chemical and physical are different?
Yeah, so the chemicals, octinoxate, homosalate, if you read the labels, you will see.
But there's not any way we would know, like if we went to Target or something?
Yes, if you go to Target and you look at the label of what's in it, if it's zinc oxide or titanium dioxide, it's physical. If it has anything else, which again, there's about 5 of them, then they're chemical. And sometimes some of them have a mixture, because the mixture will give you the physical protection with a little bit more elegance, where it can rub in a little bit better. Like Elta MD, for example, there's one that's called UV Daily that I've loved forever. It has one chemical and physical, and it rubs in beautifully compared to just the pure physical. But yes, if you read the label, it's easy to see if it's chemical or physical. If it's titanium or zinc, it's physical.
There's no like flashing red sign on the front that says this is physical.
It might. I
don't know. I mean, I don't know. I'm just curious for those of us who wouldn't.
Flip it over, put your readers on, and see what's in it. Yeah,
I know. Also, I'm holding back on the readers. I'm there, but I just carrying them around sounds a little annoying.
That's good. That's the gateway. Just carry them.
Yeah. Yes. So as we're switching to the summer months, like what do you think about? I've read that you should change your face wash, you should change your lotions, or blah, blah, blah. Like,
interesting. So obviously we live in Colorado. So for all the listeners that are not in Colorado, maybe it's different for you. But dryness is obviously a huge problem here. And it's a little less dry in the summer. I mean, we live in a desert, so it's dry all the time, but the heat's not on our house. So using products that hydrate us is going to be important. And I would say really the biggest change would be potentially how much moisturizer and or what moisturizer you need. But otherwise, you really don't have to change much. Now, we tell people, again, you should wear sunscreen every day if you're in a good habit. Summer, winter, it doesn't matter, and you don't need to change. Some people in the winter need to put a moisturizer under their daily sunscreen that might have a moisturizer in it for an extra moisturizer, where in the summer you might not have to do that. But your cleansers don't really need to change. We'll talk about retinol and retin A, which is really important for anti-aging or preventative aging. But people can still do retinol and retin A in the summer. You just wash your face and take it off in the morning because it makes you sun sensitive. But really, a good skincare routine can be year round. You just might play with your moisturizers a little bit depending on how dry your skin is.
What is like a good routine? I mean, I've read about the, the 10-step that is really popular with Korean, like in the Korean beauty culture.
Yeah.
Let's just go with
let's go with basics.
Yeah, the bare minimum.
Exactly.
And then maybe like a couple add-ons.
Perfect. Okay. So sunscreen, okay, but bare minimum, everyone should wash their face twice a day, okay? And really the default, unless you're really oily would be a gentle cleanser. And again, we can talk about brand names. And to be honest, your gentle cleanser doesn't really matter. It's on for your few seconds. So whatever would make your skin feel clean is great. Okay. And washing your face twice a day, because at night you get a lot of dirt and oil buildup from sleeping. It's nice to put on your products with a clean face in the morning. And then at night, of course, like you wear lotions and a lot of people wear makeup and you get buildup through the day and you want a clean face, clean your face at night before you go to bed. Okay. So a gentle cleanser or some kind of cleanser twice a day. Okay.
Does it matter if it's foamy or not? Because I've read
No,
like
that would be
sometimes the foamy.
preference.
Okay.
Yeah. And you know, the skincare companies are really good at saying if this is for, dry to normal or normal to oily. And so you would kind of go with how your skin how your skin is. And it may fluctuate. You may have both. You may feel oily at night, whereas you wake up dry, whatever. You can have multiple cleansers. But really that's just feel and, how like what your skin likes. Now, a good moisturizer. Now, people want to know, oh, what's a good moisturizer? And as we age, our skin gets drier. Part of it is our estrogens dropping. We'll talk about collagen, but we don't hold water as well. Our dermis is thinning again, where a lot of sugars in there are not existing because they're thin and we don't hold the water. So a really good moisturizer, and these tend to get kind of expensive, will have ingredients added into them that will help you hold on to the water, not just seal it in. So like if you get a regular moisturizer over the counter, they're decent, but they're mostly sealants. So the ingredients will just coat your skin to hold the water from your cleansing. And then as soon as that kind of dries up, it evaporates. A good moisturizer will have something like hyaluronic acid. There's some other ingredients. That's the one people knows that hopefully penetrate into your skin and hold on to the water so you stay hydrated longer, so that your sealant doesn't have to be as greasy. Once we start putting greasy things on our skin, it might feel good, but it could clog your pores and be hard to apply things over it. And so a good moisturizer will help your skin feel hydrated at the time and hopefully stay hydrated. So cleanser, good moisturizer if you need it in the morning, most people do. And then you can put an antioxidant on. Now, this is not a must. If you want multiple steps, then the morning is a really good time to do something that's preventative. So we prevent before we go in the sun in the morning. So like a vitamin C serum, you would put that on in the morning because vitamin C is what's called an antioxidant. And when we're in the sun or getting UV exposure, our body makes oxidative free radicals and antioxidants eat those up. So the best time is to put it on before you're going to get that exposure. So there's a ton of different antioxidants, but vitamin C is probably the one that people know the most. So that should go on the morning if you're going to use one. And then you would put your sunscreen kind of last, especially if it's a physical, because you're kind of like sealing it in. It's a physical barrier. So in theory, if you put your sunscreen, a lot's not getting in over it. And the rule of thumb, as we talk about skincare, because people do end up with a million things and they're like, what order, is actually like thinnest to heaviest. So if you have a serum, that would go first, versus then if you're going to put some kind of peptide cream or something, that goes over it. And then your sunscreen goes last. So the morning, if you wanted a good skin, routine, would be wash your face, put some kind of maybe antioxidant serum on, put your moisturizer, put your sunscreen. Okay. If you don't do an antioxidant, moisturize, sunscreen in the morning.
And then,
Yeah.
I know, well, before I talked to you, I used to wait, right, for it to dry.
Oh, yeah.
Because I thought that that's what you're supposed to do for it to be more efficient or efficacious.
Yeah, efficacious. Yeah,
thank you.
The more people wait, the more they don't want to do anything. So
yeah, I get bored.
Just get it on. Just get it on.
Okay, it doesn't matter.
It doesn't matter. Ideally, again, as we're talking about sealing in the water, like putting a moisturizer on when your skin's still a little damp actually is a good idea because it keeps the moisture there. But really, I mean, cleanse your face, kind of get most of the water off. You can put your serum, your moisturizer, and your sunscreen right away, and you can just put it on. At night, that's where we want to do our repair And so the most common thing that we recommend as we age, but really you can start this at any point other than anytime someone wants to be pregnant, you can't use a retinol, but a retinoid is really important. Now, retinol is over the counter. It's a precursor to retinoic acid, which is, we know it as Retin A. And there's tons of data on that being really good for aging skin. It helps to build collagen. It makes your skin look and feel better. It can minimize your pores. Your skin will look more robust. And so being consistent and finding one that your skin can tolerate and being able to use it every night will give you the best results. So a retinol is a good place to start, especially in Colorado if you've never been on one, because our climate's really dry. And so Retin A or retinoic acid or tretinoin, that's the generic like medication name, can be a little harsh if you first start it. And so using a retinol to kind of get your skin acclimated to it, and then whether you move up to something stronger or not is kind of up to how your skin tolerates it. But if people say, what are the two things I can do? Sunscreen and retinol or Retin A have the most data on being the best for, again, anti-aging. And then at night, it's really important to use, again, a good moisturizer. And then there's other things that if you specifically have brown spots, you can use something for brown spots. And then there are things that have peptides, which help your skin rejuvenate. And so there are a million things that you can build on, but the three basics would be antioxidant, retinol, and sunscreen.
And then do you recommend that everyone just at lunchtime put on more sunscreen? I mean,
good question.
I know that that's not.
Yeah, no, it depends
like a lot
on
of
what
us will be like, no way, but
no, it depends on what you're doing. So if
Yeah.
you're in your car, and actually if you wear makeup or if you wear tinted, there's some really good powder sunscreens that you can keep in your purse or car that won't melt, that you can just put on like every few hours. And if you're going to go out for a walk at lunch, like not a bad idea to just throw it on right before you go out for a walk. If you're indoors, do you need to reapply? I mean, probably not, but I always reapply, especially in the spring and summer before I get in my car to drive home, just because it feels really intense on your left side and hands, like for the drive. So if you're going to be outside at any point during the day, it's really good. And if you happen to be lucky enough to get a workout or something during the day, then you should put more sunscreen on. So, yeah.
Okay, I had a thought, but now it's just left me.
Sorry. If you think of it, let me know.
No. I have so many questions that I think they all just. So what if you're like I love the way the sun feels on my face sometimes, right?
Yeah.
And now sometimes I'm wearing these big hats, and because I'm trying to get rid of all these age spots and all these other problems caused by my previous sun-loving ways. But sometimes it just feels nice. Like,
yes.
Is there any part that's like safe or?
Yeah. Well, I guess safe isn't the right question. From a cancer perspective, like any UV that's getting through could cause damage. Now, if you were, wearing a coat of sunscreen, would it be completely safe? Yes, probably. But there is a balance. Like I love to be outside too. I don't hibernate. When people tell me, oh, don't worry, I hibernate, I never go out. I'm like, well, that's not good for you. Like you need to be outside. We need to feel nature. We need to feel the sun. It's actually really important. We can talk about vitamin D. So being outside is good for us. It is good to feel the sun on our skin. But again, depending on who you are and how your skin has any innate protection, you do need to be wearing sunscreen. So as long as you're wearing enough that you're not really causing damage or getting burned, you are safe. Now, over time, people are going to get tan. Tanning does mean you're getting exposure and your body's like, what are you doing? And it's trying to protect itself. So it is signaling that you're getting something that your body is trying to protect itself from. Now, we think
That's
that's
interesting,
pretty
right?
and we
Yeah,
feel
no, it's
good.
so interesting because we're like,
And people
but
do kind of look better because they have a glow. And again, culturally, we've decided now in Asian cultures,
oh
you look
gosh.
better if you're white.
My grandma
Yeah.
used to say, "Why are you so dark? You're so ugly." And I was
Yes.
like,
So it
"Wow,
is
that's harsh."
cultural.
Yeah.
But there is something that does feel good about the sun on us, and whether it is vitamin D production or whether it's just the sun in the air,
Yeah.
um, it. I think it's important to be outside. And actually, like talking about tanning beds, there was a study of the addictive nature, and not even like how people look, but the way that the UV gives off endorphins to people created an addiction that it was good for their mental health that they needed to tan. It wasn't just, oh, I like looking tan. So cutting that out was actually something that was like more like treating an addiction than just like reshaping their cultural expectations. And like spray tan wasn't totally replacing what they were getting from, a tanning bed. So the answer is yes, it's a balance. Be outside, wear sunscreen. If you're getting a lot of, sun, try to reapply. If you're really getting direct sun and it's Colorado and it's July, like you need to wear a hat, like you need to wear clothing, because there is probably no amount that's going to really protect us. The UV index is so high. And so, yes, safety wise, you can be outside, but it really depends on who you are and time of day and year and where you are. So,
Okay. I
yeah.
mean, my hat, like I don't know how big your hat is, but I feel like I can't hear or see anything outside of my hat.
Yeah, and there's certain times you can't wear it, right? If you're going on a run or if you're at a sporting event and you don't want
Yeah,
to
no,
block
it's
people behind
obnoxious.
you.
Yeah.
Yeah, I mean, if you're at the beach and you just are, you want the sun, but you're going to protect your face, like the bigger the better. If you're gardening, oh, that bigger the better, because you just are getting so much. It reflects from the ground. So if it's not restricting the activity and making your activity, less enjoyable, then wear it. But otherwise, there are times where, if you wear a baseball hat, that might be good enough, or it's better than nothing. So you do what you can. Again,
Yeah.
it's within reasons. You have to be happy and do your activities and live your life. And if you can protect your skin at the same time, that's great.
Yeah, I feel like I've become like a meme where I'm wearing my like
Yeah.
huge hat and my weighted vest, walking around,
Yeah.
trying not to get any sun, and
Well,
it's
there's a
like
big joke about
ridiculous.
like going on vacation with a dermatologist. Everyone else is in their string bikinis and we're just like head to toe. It's like got our eyes out, like, okay, this is fun.
Oh yeah. Well, I mean, my grandma used to try to put the umbrella over me,
Oh, yeah.
like so that there's no sun that could get through.
Yeah.
That's funny. I never really even thought about that. Um, yeah. So, do you
Yeah.
go on beach vacations
Um, so I've had one sunburn in my life, and I
in
was
your
with my,
life?
yeah.
That's
And
amazing.
I know. I was also lucky. I actually had really olivey skin as a kid. I've gotten lighter now just because I'm really not in the sun that often. But I did have really dark skin, and my kids have really dark skin, and so does my husband. And so I did have that genetically. My sister's fair and freckly. She had many sunburns, just because she was outside, and blisters. So I never really got it just as a kid running around. But I did. Back to my college friends who I love. We went on a beach vacation. We were in Florida, and they were like, "We're all getting tan." I was like, I'm not into this. They're like, "Just try." So I would be like, "All right, who wants to have a catch with me and run around?" And they're like, "You're not trying hard enough." I had blisters on my cheeks. I was
Oh
swollen. I
no.
was like, "You guys, I am never doing this again." Um, and
But
yeah,
then when
so
it burnt off, were you tan and pretty?
I looked
I'm
horrible.
kidding.
I don't even know. No, it was
I remember
terrible.
thinking, I mean, because I would blister, and even, I mean, I'm darker complected, but so that must be how much damage I've done to my skin, where I would like get
Yeah.
blisters and burned,
Yeah.
and then I was
I
like,
forget what your actual question was, but
just
I don't
about
know.
your beach vacations.
Oh yeah, I
That's
still I
cute.
do so we go to the beach every year. My in-laws have a condo in West Hampton. And I love I love being at the beach. It's soothing. I'm not particularly a good swimmer, so I don't really go in, but I do like the feel of the sand, and I like to be there. I'll usually sit under a umbrella because I don't want to burn and I'll protect my skin. But I'll go in the pool and I'll go in the water and I will reapply. Um, there's also this supplement that I recommend called
Oh,
HelioCare, and it's
heliocare.
a pill. It's actually a plant that is a fern from South America that has created its own natural antioxidants against UV exposure. I guess evolutionary, it went from being a water plant to a land plant, and it created protections against the sun so the sun didn't damage it. Amazing. I don't
That's
know who decided to
crazy.
eat this and see that they didn't get sunburned, but this supplement really does help people actually not get sunburned because you take it and it's a systemic antioxidant that's very specific for UV. So there's a lot of antioxidant foods, blueberries, pomegranates, things like that, but there's no data that that actually protects against UV exposure. But this fern totally does. Um, and so I'll take that when I know I'm going to be out in the sun a lot. And I recommend that to my patients as well.
Oh,
So
that's super
yeah,
interesting. Where
people are
can
like, you
you
got
just
those
get that
yellow
at
pills.
Vitamin Cottage or where can you
I think
anywhere?
at Walgreens, we sell it in my
Walgreens?
office. So,
Yeah.
as
Okay.
a plug for About Skin Dermatology, anything that we do discuss, if you want, you can go on our website and order. But I think you get it on Amazon or Walgreens or, yeah. So,
Well, now that we've opened the door to
yeah.
all the what's effective or not, I
Yes.
have my list.
Okay. So we definitely need to talk about cosmetics and procedures and all that good stuff. So let's
Well,
go.
I mean, like I think the gateway is, you were talking about vitamins. Like, does it help? I mean, I know friends who've been taking collagen because it's supposed to help their skin and their hair.
Yeah.
I mean, you did mention vitamin D. Is
Yeah,
that,
okay. So vitamin D real quick. So if you're really, really religious about sun protection, you should have your vitamin D levels checked, and there's a range. And you really want to try to be in the middle of the range just for mental health, bone health, lots of reasons. So vitamin D is something that we do often have to supplement if we're really religious about not being in the sun. Okay. And most, as we age, especially, but most women will become a little vitamin D deficient. And our skin is not as good at metabolizing vitamin D through UV exposure as we get older anyway. And so that's really important. Now, skin is the biggest organ. Okay. So, like anything in your body, the things that are good for any organ are good for your skin. So, good nutrition, right? Eating really good foods, staying away from things that are inflammatory to you, right? So people ask, well, can I eat dairy? Can I eat gluten? I don't know. If it doesn't inflame you, sure. If it inflames you, don't. And if it does, you're probably going to have some skin issues. Getting good sleep, exercising, hydrating, all the things that are good, not smoking, minimal alcohol, all the things that are good for
yeah.
everything are also really good for your skin. You get a good night's sleep, you didn't drink alcohol, you ate really well, you exercise, your skin's going to look really good. If you have inflammation in your body, you might get rashy, you might get pimply, you might look like, you're kind of blah. So just in general, without trying to add anything, taking really good care of yourself overall will also help make your skin look and feel better. Okay. Collagen is an interesting discussion. The data is coming out more and more about whether it's good for your skin. Um, Hard to know. I actually did start taking it partly because people asked me and I wanted to see what it does. I think what it has done is it's made my joints feel better as we get older in terms of exercise and recovery. And as you and I both like to exercise, like it's sometimes really hard to recover and then
Yeah.
do something else the next day. So I feel like collagen has actually helped. Um, I don't necessarily know that I've seen any hair or nail or skin changes. Now, we will see as more data come out. I do think if it's one of those things where it doesn't bother your stomach and you could afford it and you just want to add it in and see how it works for your body, like do it. I feel like it is kind of harmless unless it upsets your stomach. Um, Do I think alone it does enough to see a difference? Um, I don't. And people always ask me, "Oh, are you taking it?" I am, but I'm also doing lasers and needling and retinol and everything else and fillers. So like, it's hard to know, is this one thing really making any difference? Um, so
Well, I
that's
guess,
yeah.
yeah, and like along that line, like what about probiotics? I mean, a lot of things I've read is like your gut health really
Yeah.
translate to your skin health.
Yeah.
Um,
So if we're talking about me, I've been taking Athletic Greens or AG1 for, I
mhm,
don't know, 7 or 8 years, which have some probiotics in there. Again, nobody knows. Everybody's gut is different. I can't take a pill probiotic. It makes me queasy.
yeah.
Athletic Greens has been great and it has other nutrients. Do I know it's the best one for everybody? I don't. In terms of, gut health, which is definitely an avenue that we are learning more about as being a link for wellness overall and immunity and probably our skin too. Um, it's again, it's hard to know if you have gut health and whether you need it. I feel good taking it. Do I know how I would feel not taking it? No. As long as you have regular bowel movements and your body doesn't feel inflamed and you're not feeling bloated, you should do something that feels good to your gut. So again, not a cookie cutter answer. You've got to find what feels good to you, at least for now, until we have better testing to say, oh, you're deficient in this microbe and you need to supplement this. We don't right now. So,
Okay.
but yes, I take Athletic Greens. So
Anything else we should be taking or that you take that you think is helpful?
like supplement wise, no, just eating really well. Yeah.
Um, okay, I have so many questions, I don't know where to start.
Okay.
So I might just go down my list of things I've heard about, and you can just tell me like what you think of them, if they're efficacious,
Okay.
um, and what you recommend, or like what's kind of just a waste of money
Okay.
or waste of time too. Like some of it,
Sure.
like I
Yeah.
understand that some of it is, self-care. So is that ever waste time? I don't know.
Okay.
Okay. So here, my list starts with red light therapy. So I get
Okay.
confused between red light therapy and the LED light therapy because they're different, right?
Okay. So
One is, I mean, because all those masks are everywhere, like the ones like the Dr. Gross mask that like you look like you're a killer and you
yeah.
glow. Yeah.
Yeah, those okay. So, visible light. Okay. So mostly we're talking about actually like red or blue,
Okay.
but it's in the visible light spectrum. So not UV, where UV again is damaging to our skin, but kind of in the visible spectrum. Okay. Um, so let's talk about red light masks because those have a lot of Instagram
Yeah.
prominence.
Yeah, they must
And
know that I'm looking because I
exactly. And
can't, I'm
now
like, oh my
anyone
God,
who's
stop.
listening will get a mask at least come up on their ads. So there was actually a recent article in our Journal of American Academy of Dermatology about red lights or this is a hot topic. And it does show that if you do it consistently, now red light, the masks per se are different depending on which one you get. And again, like skincare and sunscreen, the one that you're going to use is going to be the most effective. So they come as a mask that you wear. Some of them you lie under. The wands are definitely not as good as like something that you wear.
Okay.
So based on whatever the one that you get, if you do it frequently enough, which is going to be a few times a week, it shows that it may increase the complexion of your skin. It may improve it. It may build a little bit of collagen. So in theory, there's benefits to them, and they're expensive-ish. Between $300 and $400 usually. I got one sent to me that was one where I lie under it. I found it really difficult to use. You have to wear these goggles and you really have to cut out for a bit. And I couldn't figure out how to do that.
It's like a mini
But
tanning bed.
I guess totally. And I don't know. And if you have a mask that you will wear, and you can watch TV or
Yeah.
you know, cook dinner, and some of them have eye openings that you still could function, and you do it, there's probably some benefit. Alone, are you going to look in the mirror and then 6 months later with a red light mask feel like you made that much difference? Honestly, probably not. Um, but it may be something that feels good. Again, anything that reminds you to just, you know, you might have to meditate for a little bit to breathe. You're doing something good for you, and maybe there's a little bit of skin benefit. Probably is worth the money if you would use it. Most people buy it, they use it for a couple of months, and then they sort of don't use it. So,
Yeah. Okay. What about microcurrent devices like New
um,
Face? I've seen those too.
I know. I don't know that. Honestly, I don't know that much. I mean, I could probably speak better to the things that we do in my office that will always go deeper. I could give you a rationale why moving blood flow and lymphatics and anything like that would be good for your skin. And that's true for anything. Anytime you're, you know, you're doing something that keeps blood flow moving, which exercise can do that too, again, probably is good for you. I don't know that there's enough to say that that is going to make a giant difference, data wise. So, yeah.
What about like, so maybe gua sha is like the same, or like facial yoga, like it's just
Yeah.
moving the blood around-ish.
Yeah. So here's the thing, Betty. So the way that we build collagen, because as we're getting older and, you know, as our hormones go down, even if we replace our hormones, um, most of these anti-aging things, if we're not talking about, again, brown spots or even really, I guess wrinkles we're talking about, but as we like our skin gets more lax and we lose collagen, we're trying to do things that rebuild that. Okay. And the best way to do that is with devices that create little micro wounds in the skin to stimulate your body's natural ability to build and repair. And when we have a wound or a cut, we make collagen. And so the devices, the reason that the ones in our office are going to be more effective is they can go deeper and they can create more wounds. So lasers do that with light, and there are devices that do that with sound. Those are called radio frequency devices. And then mechanically, you can do that with needles, so microneedling. And so we have different ways that we do things to create these wounds and a wound response in our skin. And ultimately, we definitely will see an improvement in our collagen. So anything you do at home, to be honest, that doesn't really hurt is probably not doing that much. Like it kind of needs to create a little
No,
pain
I mean that's
so that your
fair. Like I
body
think
can
that's what we
repair.
want to know, right? Like
So
it's
it's worth
fair.
it. It's worth it to save your money every time you see an ad. Put it towards something that you're going to feel like you're being
I
tortured,
don't know what you're
and
talking about, Sam.
and then you're going to have a benefit. So
I
every
don't
time
have a
you
clutter
want,
full of stuff.
yeah, take all those things out of your cart, take the money, put it in your dermatology or whatever
Yes, it is
fund,
fun. Yes.
and yes, and do something that's going to create some real benefit.
Okay, so now that we're there, like, what do you find creates real benefit? Let's say,
Yeah,
like for me,
yeah,
so like uh, age spots, right?
yes,
And
yes,
it's like, what
yeah,
do we do for those?
yeah,
And the wrinkling, of course,
yeah.
but we have
Yeah,
Botox for that.
let's
Yeah.
yeah, we can let's talk about injectables after, but let's talk about brown spots. So age spots, or the medical names called lentigos, people have freckling, discoloration, you know, that is a lot of it is from sun damage. Some of it's genetic, but people will pigment again more as they age and with more sun exposure. So the best way to get rid of those are with certain procedures. So there are creams that you could prescribe. The main ingredient in the creams are called hydroquinone. They kind of help. Alone, they don't really take the spots away. They may help them not get worse, and they may lighten them a little bit. But to really get rid of age spots or brown spots, you're going to want to do a procedure. Okay. Now, lasers. So a laser uses a light to have a targeted endpoint. So the ones that will help for brown spots have pigmentation as their target. Okay. And there's different names for so many different lasers. The most common one that people will probably try first is called an IPL. It's called intense pulse light. So it's actually a broad spectrum of light that can target different things, but it really helps for pigment. People have to be really careful with IPLs. They are really good for discrete sunspots on fairly bare skin. So skin is graded with a Fitzpatrick scale 1 to 6. I would say an IPL is really good for people that have a 1 or a 2, like really light with sunspots, because it targets the brown and it really wants to leave alone the rest. And if you have background pigment and tan, you run the risk that you can hypopigment the background. So a photofacial or an IPL is really good for people that are fair with sunspots. Okay. If you are darker, or have any baseline tan and you have sunspots and you want to do a laser, then there are different wavelengths that will create less energy and a less reactive response to those background, to the background brown. And the laser we have in our office is called a thulium, or Lace MD is the brand name. It's a 1927 laser, and that's a really good one for actually most people. It makes you feel like you have a sunburn. It can exfoliate your skin. So actually in Europe, they use it a lot as a standard for precancers. We recommend it for people that have precancers and also want to treat their pigment. It's safe for melasma. It's really good for anyone who is skin type 3 and above. You can do it as much as you can handle. And your skin looks and feels refreshed. And it doesn't go super deep, so there's not a lot of downtime, but there's enough that you turn your skin over and you're building a little bit of collagen, a little bit, but it's really good for background sun damage. And then there's much bigger lasers that you can combo that will get some browns and then also go deeper. Different target would be water to deal with the wrinkles, because the endpoint and target for the laser is different depending on what you're trying to treat. And some of them will combo it so you can kind of get everything. But from a brown spot perspective for lasers, IPL, if you can do it, this 1927 is really good kind of as a next step up. And then people do chemical peels. Some people like peels and other people don't. You can do peels that are safe on all skin types. So that's a really good way to improve texture, the pigmentation safely. There's not as much prep there. It's a little bit cheaper. You can do them at home. We can do probably a little more aggressive peels in our office. If you're sensitive to chemicals, you got to be careful. Some people get really irritated with chemicals, and so a peel may not be the best option for them. But that is a good way to do a lot of maintenance for pigmentation and brown spots with getting improvement. So.
And how often do you recommend that? Like, should people be doing these things like once a quarter,
Yeah, I mean, in
or
the
hammering
perfect
it
world,
out, right? Like,
if money and time was no object, we would recommend doing something every 3 to 4 months to keep that turnover and keep that collagen improving. So yes, in the perfect world, every 3 to 4 months, trying to do something to improve your skin.
even like you could do these things even before summer or during summer, or do you
So some
wait?
you can do during summer. So you can't really do an IPL because you really can't be out. You don't want to be tan. But anything else, you actually can. You want to be sun protected afterwards. And in theory, the less tan you are, the better treatment you're going to get. But if that's when you have downtime, then by all means, you can do stuff. You can do stuff in the summer.
Well, and I've had friends who've done Halo, which apparently I
Mm-hmm.
shouldn't do, but like their skin looks. Well, one gal, she did not react well at first, and then once the healing.
Yeah.
But that's supposed to be very hardcore, right?
So Halo it's a great laser. It's a combination of what's called an ablative and a non-ablative laser. And so now we're pivoting for kind of wrinkles and more collagen because that laser goes deeper in the skin to create those wounds. And an ablative laser will actually like kill the skin so your body is like really recovering from it. And a non-ablative will just create a little damage. You will react. The more ablation you get, the more wrinkle improvement, but the more pain, scabbing, downtime you get. So Halo is a really good combo of the mixture. So you get benefits for wrinkling and texture without a lot of downtime. And the company that the platform that the Halo's on is also the same as what's called a BBL, which is a version of an IPL. So a lot of times we will combo them. So you will get a BBL first to get rid of some brown spots, and then you'll get the Halo on top of it to do the wrinkles. So it's a very complete session, really effective for your time, but you can have healing, you get some swelling, like you need to kind of like prepare for it a little bit. And then you have to be careful. You can have some acne after, and your recovery is a little bit different than some of the less aggressive lasers.
And the reason why I can't do it, or somebody with darker skin, it's more dangerous for.
Well, anytime you're going to do something where there's a lot of heat and you have darker skin, you run the risk of, again, hyperpigmenting. And that's the last thing you want to do when you're trying to do a laser. And obviously, we don't know if that's going to happen every time. But the more heat and the deeper you go, the more risk that you're going to have that hyperpigmentation reaction afterwards. So you unfortunately do have to be more careful. Good thing you don't have a lot of wrinkles.
Well, that comes, you like, then you have Botox. Like, can you do these things? Like, should you, if you're doing Botox or fillers, like, how do you plan that with these other things? Because they're kind of doing different.
They're totally doing different things.
Right?
So let's talk about injectables. So now we've sort of talked about, we're kind of into the world of cosmetics, and there's a million things out there, and they all target different things. And so the truth is, like, you kind of need them all. But injectables, okay? So Botox is a brand name. In our office, we use a lot of Dysport, which is a rival, just different companies, very similar product. And we call them toxins. People are like, ooh, that's a weird
Let's shoot that
word.
in my face. Yeah.
But it's like, we don't always want to use a brand name. If we're using the other, it confuses people. So what toxins do is they make you not able to utilize a muscle as well, so that when you have a wrinkle and you're not moving, you're not reinforcing the wrinkle. And again, as we get older, we lose elastin, we lose collagen, and when we move, our skin doesn't rebound back. And so the less that we move, the less wrinkles are being reinforced by that movement. So toxins will knock out the muscle movement. Like, I can't do it that well. And if you start young enough, where this is true, before those wrinkles are set, then you're not moving it so much so that the wrinkles don't get reinforced. So that's how it works preventatively.
So now, the baby Botox is like, or sorry,
it's a real thing.
The baby toxins is a real thing.
Yes, and they don't need, and when you're young, I mean, unless you have really strong muscles, there are plenty of 20-somethings that have really strong muscles and they have wrinkles. Now it's natural.
Yeah.
And if they didn't move, their skin can look pretty smooth, but they move. If you kind of stop that, they will preventatively have less wrinkles down the road. Now, if you start at 40 or 50 and you've already got set wrinkles, even when you're not moving, Botox or Dysport or other toxins cannot erase those. You can only soften them. And then you kind of hope to, again, build collagen with other devices to try to improve the look of your skin, but you can't prevent it once they're there. So that is true. Like doing Botox or Dysport or something at an early age preventatively will help down the road of trying to fix it later. So the places you do it most commonly is kind of the upper face. So the glabella, the forehead, around the eyes, crow's feet. That's the most common. Now, people do a little bit in the lower face for the chin. You can do some toxin right over the lip border. People call that a lip flip. And what it's doing there is it making you not able to pull down on the upper part of your lip so that it turns out a little bit. Now, it can affect how you say S's and use a straw. And so the lower face is tricky for toxin. You've got to be careful. And then fillers are totally different. So there's all different kinds of fillers, but the ones that people know the most are what are called hyaluronic acid fillers. And we talked about hyaluronic acid earlier. It's a sugar natural to our skin. We lose some as we get older. It holds water. And so the fillers that most people have heard of, Restylane a brand name, Juvederm's a brand name. They are gel concoctions of hyaluronic acid, and they get injected for different reasons based on the size of essentially the size of the particles and how thick they are. So as we get older, we lose volume. So we're losing fat. Our bones resorbing. Our skin is more lax, so it's falling. And so we use fillers to replace volume. So a common place is mid-cheek to kind of lift up. You can kind of do it along the cheek and out here also to try to support and revolumize areas that people have lost. And then the thinner fillers, also a lot of hyaluronic acid fillers, can be used in other areas where you have more movement. So in the creases here, sometimes here, in the lips for some enhancement, to improve wrinkles, but not really. It's just to kind of soften the edges a little bit. But those are fillers. So they're very different, and they stay in your skin. Your body eventually does break them down. It can take months. So you can get 6 to a year, maybe even a little bit longer of fillers, depending on where you put them and which kind you use. So they are different than toxin. They're injected. And they play a different role than anything that's trying to improve the skin. Now, that being said, injecting hyaluronic acid into your skin, actually, because it holds water, can make your skin look and feel better, as well as improving what you're trying to correct with volume and other things. And then the last thing that is kind of getting a lot of traction now, not the last thing, there's a million things, but
Yeah.
one of the things that is getting a lot of traction now is Sculptra. I don't know if you've heard of Sculptra.
I've heard of it.
Yeah, so Sculptra was actually invented for something called HIV lipoatrophy. So when HIV medications first came into the market, one of the side effects is patients that were taking those would look really gaunt. They would lose all of their fat. And this product was actually developed to improve the fat and the collagen in those particular patients. And then it became purely cosmetic, and it's a particle that gets dissolved into a liquid, and it gets injected, and it over time builds collagen. So it is not a volume replacer. You are not putting something in that will stay. You actually put it in, you have to move it around, and over time it stimulates your body to also, again, back to building collagen. And that's gaining a lot of attraction recently because people are now not wanting to look overfilled. They don't want to look like they have so much filler and it's fake.
Yeah.
People want to look natural, especially in Colorado. It's awesome. People want to look like they're well rested and they look good for their age, but they don't want to look fake. You want people to say, "Oh, what are you doing?" but not really know what you're doing.
Right, exactly.
And so that's our goal, actually. So, we tell people you should do things that make you look and feel good, but the goal is never that you're going to look younger. You want to look and feel as good for your age as possible. We cannot reverse you. We want to slow it down. So
like, I know there's no silver bullet, but like for somebody who has to prioritize, like, what do you think are like the top 2 or 3 things that they should try to do, or that you would recommend as like the most bang for their buck, or whatever, however you want, whatever criteria you think?
To be honest, it would depend on that person's genetics and what bothers them. It's funny. I've been to many conferences, but one of the lectures I remember was a cosmetic lecture. And, they say you could look at someone and think, "Oh my goodness, I can't believe you walk around and your face is all red," for example. But what might bother them is something totally else, because it reminds them of their grandma and they don't want to look old like their grandma. And so you may see someone and think, "Oh, I can't believe you're not thinking about fixing this," but it's this other thing that they're thinking about. And so it really, there isn't one answer. From a non-injectable standpoint, if you're in your 40s and you could afford to do procedures, you should do something with needling. So like RF microneedling that stimulates collagen. There's not a lot of downtime because it's fairly harmless. It hurts, but you're going to get improvement. It works for everyone. And then texturally and sunspot wise, like again, if you could do that thulium laser once or twice a year, you're going to get a lot of benefits, both preventatively and therapeutically in how your skin looks. But again, I say this with privilege that I have access to this, and you can do it multiple times a year. And again, from a fix-it perspective, doing toxin like early in your life, maybe a big investment and may feel like a lot of maintenance, but it will pay off when you don't have wrinkles in your 40s if you can start it. So it isn't one thing. And it really depends on, again, if you have pigment, then you're going to spend your money fixing your pigment. If you really are red all the time, then you may fix, like we didn't even talk about lasers for redness, but you may prioritize because you don't like looking like people think you drink all the time or you're always flushed and people ask you about it. So that's going to be your priority. And if you have a lot of wrinkles, again, that might bother you versus someone else that just isn't as wrinkly. So.
No,
the
that's
answer
true.
is I can't give you an answer.
No. That's actually really true. You're right. Because, redness is not, but I do have friends who that bothers them.
Yeah.
Okay. We've gone really long because I have so many more questions.
Okay.
But before we start wrapping it up, is there anything that we haven't talked about that you feel like is important to talk about or want to talk about?
I think you did an awesome job of getting me I wrote all my notes down and I think I hit them.
Oh, good.
No. I think if people have questions, they can reach out to me. But I think we covered the basics. Wear your sunscreen. If you're interested in cosmetics, go see your dermatologist. Do something that's really going to be beneficial, and live your best life. Take care of yourself overall.
Oh, I think that's all a nice message.
Thank you.
Okay, so my closing questions with every guest is, how do you maintain your own balance and peace? I think we all struggle with that, and you've alluded to the fact that being happy and living your best life is helpful for your skin too. How do you do that for yourself?
So, I think first of all, I am lucky that my job, I've always worked 4 days a week. So if anyone's listening, I think everybody should work 4 days a week. Having a day off during the week will 100% improve any work-life balance because you will have a day to yourself, hopefully to exercise, see your friends, do your food shopping, and it's a game changer. Do any appointments that you need to do for yourself. I also do try to leave my work at work. I work really hard during the day. So other people have all of my energy from 8 to 5 or 6 sometimes. And then I really try to turn it off and then come home and have whatever few hours at night that I can with my family or whatever else I'm doing. I am very habit-based and routine-based. And so I am my happiest when I create systems that allow me to do things to keep this balance. So as you know, we both like to work out and we have similar likes in how we like to work out, but I will prioritize my workouts and work my appointments around my workouts because again, I need those for my physical and mental health. Again, I'm really good at planning. I love planning. So I try to put things on a calendar. When someone says, oh, okay, we should hang out. Okay, take out your calendar. When are we going to hang out? And I put it on the calendar.
Yeah.
No, and then I kind of do it. Then it happens. I see my friends. I have hobbies. I love my family. I really just try to use my time as effectively as possible. I'm not great with downtime. So as long as, and I like to be scheduled. So I schedule things that feel good to me, and being busy makes me feel balanced actually. So,
well, no, I think that's, yourself. I think that's the nice part of where we are in life. You mentioned hobbies, like what other, we both really enjoy working out.
Working out.
But What else do you like to do? I mean, you had mentioned gardening. I don't know if you
No,
actually do
I
that.
do
No.
not garden. I have a non-green, whatever's the
Yeah,
opposite
I
of
have a
green.
brown thumb. I have a lot of dead
Yes.
plants.
My husband
But
will leave and be like, what are the plants? I'm like, oh, wait, what?
yeah, I thought
Um,
they were plastic.
yeah. I like to read. I like music. I like to go to concerts. I like to plan events and host things. I
Oh,
like to see
that's
my
fun.
friends. I like to
Yeah.
laugh. I like deep conversations. I don't know, is that a hobby? Is deep conversations a hobby?
No, but that's also like nice that you know that you want a real connection, right?
Yeah,
Because
that's what
that's
I want.
hard sometimes.
That's my hobby, creating connections. Yeah, I like to try new restaurants. But yeah, I would say music, reading, seeing my friends, and exercising.
Oh, I love that. So what's the best way to find you? I mean,
Don't
look,
find me. I'm very busy.
she's very scheduled.
I'm very
Um,
scheduled.
but like just to go to your website at aboutskin.com
Yeah,
or about skin dermatology.
about
I always
skin
put in the
dermatology.
wrong thing.
Yes,
Yeah.
yeah. So, yes, if you want an appointment, sorry, it is kind of like a ways out. But
Sam is
yes,
very hard to get into
but it's doable. It's
because
doable.
she's awesome.
No, and I've been there a long time, so I'm not young anymore. I'm old. So my website, if you actually want to make an appointment, I don't know. I'm barely on Instagram.
Yeah, I mean,
I'm Samantha Stoler. You can find me and message me, but I'm not there that often. You can, I mean, someone could email me. I have an email, samanthastoler@gmail.com if you want to ask me questions.
well, that's
Um,
nice.
I probably would give my phone number out, but not on a
No,
podcast.
no,
But
no. I was
so
like, no, don't do
yeah,
that. They,
I don't know. My office.
okay,
Find me. Stand outside with a sign and a boombox, and
oh, yes. Such a good movie. It's
it
perfect
is.
to watch now in May.
Um,
Um,
oh, it
so
is. Yes.
what do you think for somebody who's not in Denver, who can't see you? Like, how do they find a dermatologist that
Yeah.
is, I mean, board certified, obviously, right? Like,
Yeah.
but is there anything else that they should look
I
for?
mean, word of mouth is going to be
Yeah,
your best bet. Because it really is hard to know from like a website or
sure.
reviews. But if you really like, if you're moving somewhere and you don't know anyone, there's a website, the American Academy of Dermatology, aad.org, and you actually can go on there and you can put your zip code where you live, and they will spit out a list of board certified dermatologists. And then you've got to do your research like anything else. You can go on their site. You can read reviews. Ugh, I hate reading reviews about myself. But you can. But there is a list that you can get from the AAD. But really asking people who they
Okay.
like it ultimately is going to be your best bet. So
Well, this was so fun. Thank you so much for spending so much time with me.
is there
And
anything, Betty, that you wanted to ask that you didn't in your notes that you
so
oh
many,
my
but
God. Okay.
I will be respectful of your
You
time
can you can text me. You have
and
my
I will
phone
find
number.
you later.
So
Don't worry. Well, thank you so much for being a part of the podcast
well,
and
thank you
sharing
for
all your
inviting
great.
me. And I'm glad I put it on the calendar and we had a date. So it took
All
me a little while,
right.
but thank you.
Well, thank you.
All right. Talk to you later.